in body, in spirit, where it's not just a Sunday kind of faith, it's an everyday lifestyle. Go for it.
Good morning, I'm Dr. Shandana Fagans and you're watching House Calls. Today we have on our show Dr. G. Wesley Smiley, and he is a dentist here in Nashville. He also has an office in Madison, and we're going to be talking to him today. Welcome to the show, Dr. Smiley.
Thank you. Good morning.
Good morning. So tell me this. I want you to tell the audience a little bit about yourself, how you got started in dentistry.
Okay. I come from a family of dentists. My father was one of the original African-American dentists in Montgomery, Alabama. He started dentistry in 1950, so dentistry in my family has been around for a while. I also have two other medical professions in the family. I have a sister who is a physician in Memphis now, and I have a sister who works with me in one of my practices here. She's a pediatric dentist in Nashville. So dentistry has been in the family for a long time.
Okay, great. So tell me, you have a dental office called Smiley Tooth Spa.
Yes.
So when I think of spa, I think of oasis, comfort.
Exactly.
So tell us about the tooth spa.
Well, being in dentistry for over 10 years now, I have learned that people do not really like the dentist, and most of the reason is because they equate dentistry with pain. So through my work, I have noticed that patients tend to like to go more places where they can have less anxiety. And the spa caters to anxiety patients, apprehensive patients. What we do is we provide a spa atmosphere. We have soft music, we have aroma, and things that soothe you. And we also do things like painless injections. We like to say that there's no pain at the spa. And we cater to those type of people with high anxiety, as I said, and very apprehensive. And we have a lot of things in place at the spa to accommodate these kind of patients.
Well, as a physician, I know that patients don't like to go to the doctor, and I know that patients don't like to go to the dentist. How important is it for the patient to find the clinic that suits them, and what questions should they ask the dentist when they first go for the initial visit?
Very good question. There are a lot of different types of dental offices and a lot of different personalities with your different dentists. I think they should get a good feel for the dentist and see if it's somebody that they can talk to, and they need to be able to explain all of their problems with the dentist and see if he has the correct answers for them. They need to look for a clean environment, somewhere where they feel at home. So and they need to, in our clinic, we offer an array of services where we don't refer out a lot. And that is been a very good asset for us, because a lot of people don't like to go to a dentist and he says, okay, well, you know, you're going to need a root canal and I'm going to refer you to this other doctor, or you're going to need surgery and I'm going to refer you to this doctor. Well, at the spa, we encompass the skills to incorporate all of those procedures, and so we don't refer out much.
So one-stop shopping.
One-stop shopping.
Okay. So why is it important to go to the dentist on a regular basis?
Well, your mouth is the portal for entry of all your nutrition of the body, and there are many diseases that can manifest themselves in the oral cavity, and sometimes dentists are called the first line of medical professions, because we can see things in your oral cavity that may manifest themselves in the body in other ways, and we catch them at an early time. And this is really good for living and longevity.
Okay. Well, at this point, we're going to take a commercial break, and we will be right back with House Calls.
Join us at Cathedral of Praise, located at 4300 Clarksville Pike, Nashville, Tennessee. Worshiping services beginning at 8 a.m. and 10:45 a.m. Bishop Jerry L. Maynard Sr. and the entire congregation would love for you to be our special guest, where we're maximizing our potential.
Welcome back to the House Call segment of In Body, in Spirit. We were talking with Dr. Smiley of Smiley Tooth Spa. So, Dr. Smiley, how often should a person visit the dentist?
Well, you know, there's a saying that every 6 months a person should have a visit, but this is kind of was determined by insurance companies, because that's how often they're willing to pay for a preventive visit. But it's very person specific. Some people with different conditions need to visit once a month, and it can go from once a month to, some people are meticulous about taking care of their teeth. They can get away with going to the dentist maybe once a year. So it's just case specific. The most important thing is getting the person in to do a thorough evaluation.
So at what age should you have your first dental checkup? Because when you think about children, their teeth fall out anyways, especially when they're toddlers and babies. Should a parent bring their baby to the dentist that has, you know, a little tooth that's going to fall out anyways, especially if they have cavities, you know it's going to fall out with
That's
differences.
very good, Doc. I get that all the time. Some people only bring their kids in when they have pain. What we recommend is that at 18 months, if nothing happens prior to that in the oral cavity that's a problem, at 18 months you should come in for your first checkup. Some babies are born with teeth in their mouth. And
Really?
yes,
Wow.
and those kids need to come to the dentist almost immediately so we can govern and facilitate the progress of their development. But at 18 months, it should be your first visit. And in our clinic, we cover from 18 months to 108 years. You know, we cover all we have, and it's another asset that we have. We can do from the pediatric dentist to the elderly geriatric dentist.
Okay. Well, I know that, like we said, people are afraid to go to the dentist. What procedures do you have in place, such as sedation, that kind of help with that anxiety?
Well, as I said earlier, we like to say that we do pain-free injections. We have a dental device where we do a device where it's called the Vibe, where we used to do injections, and patients hardly feel anything. As a matter of fact, patients say, "Oh, have you already finished my injections?" I say, yes,
wow.
so it's a really good thing. But we offer an array of sedation techniques too. There in the spa, we do from nitrous oxide to conscious sedation to even general anesthesia, IV sedation. So we have several methods to soothe you, and if you have very high anxiety content, then we might even put you all the way to sleep with general anesthesia and do a total oral rehab.
Okay. Well, let's talk about implants. Do you recommend implants, and how safe are they?
Implants have come a long way. They're safer now. Implants, what people don't realize, it's sometimes 6 to a 9 month restoration. If you have a total edentulous ridge, which means that you have no teeth, like on your top arch or your bottom arch, then sometimes if you have a lot of bone loss, it is recommended for implants to retain a denture. But as far as single tooth space, I recommend bridges more because it's a much faster restoration and it's more reliable.
Okay. Now, let's talk about fillings, because I know fillings are very common. People get cavities and they have the silver fillings, and then there's the clear fillings. What is the better filling? I guess they call them amalgams.
Yes,
That's
yes.
the proper
Yes,
term
amalgams
for
have been around for a long time. They're the silver fillings, and some people call them black fillings because they kind of turn dark.
Mm-hmm.
And a lot of people want to change them to the new composite fillings, which are white fillings. Sure, we can do that. We sometimes have to explain to our patient that it can cause sensitivity. And actually, the amalgam old fillings, the amalgam is an alloy of metals put together, and that has been the most compatible to tooth structure that we have found. And they do tend to last a little longer than the white fillings.
So how is that different from gold crowns? Is that?
Well, gold crowns actually, a lot of people come to my office and say, you know, I've heard that these gold crowns are going to rot my teeth out. Well, a lot of people go to what we call chop shops in the malls and things, and they get the gold coverages. They're not done by professionals, and if it's not done right, yes, they will rot your teeth out. And the content of real gold in those alloys that these shops use are not higher enough percentage. But when you go to an actual practicing dentist and they put a gold restoration on your tooth, that's actually the most compatible to human tissue and the best restoration that you can find.
Okay, great. Well, we're going to wrap this up. I know people use different toothpaste and you got different brands. Is there anyone that is better than the other? And how important is fluoride in the toothpaste?
That's a very good question also, Doc. Fluoride is very important, and as a community, we have put fluoride in drinking water, in fountain water to help with people's teeth. But however, everybody's gone to bottled water these days. And so bottled water doesn't have fluoride, and so they're missing out a lot. The important thing and what you should take away from this is that you visit your dentist. There are conditions called fluorosis and enamel degradation that are caused by too much or lack of fluoride, but only the dentist can determine that. And we will tell you what the regimen of fluoride that you need.
So if our viewing audience would like to get in touch with you and make a dental appointment, what's the best way to reach you? Where you're located, your phone number, website address, Facebook?
Sure, you can reach us on the web at smileytoothspa@hotmail.com. And our office number is 615-678-1051. We're located off of Due West Avenue in Madison. We're in the Medical Dental Complex there. The address is 500 Lentz Drive, Suite 70. And we're taking new patients. And as a part of being on your show, which I really do appreciate it, we're offering to all the patients that come in and mention In Body and Spirit a free consultation.
Wow, you heard it. So if you go to Smiley Tooth Spa and mention In Body and Spirit, you'll get a free consultation. Can't beat that, because I know that, dental expenses can be very high. So
Very high.
Well, this is the end of our segment of House Calls, and we will see you next time. Good morning, I'm Dr. Shandana Fagans, and you are watching House Calls, where we come to you through television addressing the health issues that affect you, your family, and the community. Today we have Dr. Alicia Hall. She is a physician here in Nashville. Her specialty is in family medicine, a graduate of my alma mater, Meharry Medical College. So we are so excited to have you here this morning, Dr. Hall.
I'm so glad to be here, Dr. Fagans. Thank you for having me.
Now, you have a medical practice here in Nashville. It's called Advanced Care Centers.
That's correct, yes.
Tell us about Advanced Care Centers, how long it's been established, and give us a little information about it.
Yes, well, Advanced Care Centers has been established for almost a decade now. We started back in 2004, and we are located here in Nashville, Tennessee. Our parent clinic we have a second location in the Jeffersonville, Indiana area, Louisville, Kentucky area.
Oh, wow.
Kentuckiana, as they call it. And what we do, we actually specialize in rectal problems such as hemorrhoids, and we offer non-invasive treatments for hemorrhoids so people don't have to have surgery.
Now, I know what hemorrhoids are, but not everyone knows what a hemorrhoid is. So tell us, what are hemorrhoids, and what are some of the signs and symptoms of hemorrhoids?
Yes, well, all a hemorrhoid is just an enlarged, swollen vein, similar to varicose veins in the legs, but they occur in the rectum.
Okay.
And so that's what they are.
Are they painful, or can they be painful?
They can be. If they can cause burning and itching and pain and bleeding and a lot of discomfort and disruption of people's lifestyles.
So you do a procedure at your office. It's called IRC. Tell us what IRC is and what that acronym stands for.
Okay, so IRC is infrared coagulation. It's similar to a laser treatment in that it's a light heat energy source. It's just a whole lot more gentle.
Okay.
And so we use this procedure to actually coagulate hemorrhoid veins, and that destroys them and causes the hemorrhoids to shrink and go away.
So is it a painless procedure?
That is the beauty of this treatment. It's gentle and it's pain-free.
Are there any side effects with the procedure?
With the procedure, there may be some pressure in the rectum after the procedure, but it's a very quick, simple, painless procedure done right in the office. Only takes a few seconds. People can go back to work the same day. There's no downtime or a recovery period. They don't have to take away time from work or family.
Okay.
So that's the beauty of it.
Well, that sounds good. So we're going to go to a commercial break, and we will come back and talk more about IRC.
Join us at Cathedral of Praise, located at 4300 Clarksville Pike, Nashville, Tennessee. Worshiping services beginning at 8 a.m. and 10:45 a.m. Bishop Jerry L. Maynard Sr. and the entire congregation would love for you to be our special guest, where we're maximizing our potential.
Welcome back to House Calls. I'm Dr. Shindana Fagans. Before the commercial break, we were talking to Dr. Alicia Hall about the IRC procedure, which is infrared coagulation. Dr. Hall, so what should a person expect on their first visit, and how long should they expect to be there for that visit?
So on a first visit, first of all, they're going to be greeted by a very warm, open, and friendly staff, very professional and confidential. They will get a thorough history and examination to make sure they're a candidate for the treatment. And if they are, we actually do treatments on the very first day of consultation.
Now, what makes a person a candidate for the treatment? Can you briefly tell us that?
Yes. Well, there are different types of hemorrhoids, and we treat internal hemorrhoids directly. And so actually, if they have symptoms like bleeding, pain, itching, have issues with constipation, then and we see that they actually have internal hemorrhoids, then that makes them a candidate for the treatment.
Great. How many treatments are required for the procedure?
On average, most people require anywhere from 4 to 8 treatments, and treatments are 2 weeks apart.
And does insurance cover the procedure? Because that's a very important question.
Yes, it is, and thankfully, yes. Most major insurances cover the procedure.
Now, how effective are those treatments, and how long does the treatment last?
The great part about this procedure is that 95% of people who have it do not have to have surgery.
Great.
So it's highly effective, and they last for years. On clinical experience, at least 4 years, but they may never come back. It just depends on a person's lifestyle and risk factors.
So if someone wants to get in touch with you, what's the best way for them to reach you?
Our phone number is 615-329-7969. And if they just call, the staff that's there will definitely schedule them in.
Great. So it was great having you on the show, Dr. Hall. We'll have to have you back again another time.
Yeah.
Is there any last thoughts that you would like to leave, for example, regarding colonoscopy screening?
Yes.
I know that's very important.
Well, first of all, every person should get a colonoscopy screening by age 50. It's life-saving. It's one of our most cost-effective screens. 60% of colon cancer deaths can actually be prevented if they had their colonoscopy.
Wow.
And they were treated early for any polyp or any other situation that was found. But for those that have bleeding, pain, itching, or other issues going to the restroom, most times it's due to hemorrhoids. And so please come and get something done. You should not suffer and sit in silence there. You can have something done that's pain-free, non-surgical, and very effective.
Well, great, and insurance covers it, so hey.
Yes.
Call Dr. Alicia Hall, and if you have any of those symptoms that were discussed on the show, and we will see you next time on House Calls. Don't miss your house call.
Hello, my name is bassist Bernard Harris. Actually not bassist, but since my name starts with a B, you can't help but to put bass in front of it. I'm originally from Raleigh, North Carolina, but I currently live in Nashville, Tennessee. A little bit about the journey. It's kind of hard to put it all in a few words, but I definitely started off in church. My father was in a quartet group in the Carolina areas, and we would travel with him every Sunday or Saturday to some church or school doing a program. And a program back then was a concert that they call today. But I was always with him and wanted to be a musician. So seeing that and seeing all the instruments on stage, going through a series of things from trying to play piano to drums, I finally ended up on bass guitar, where I have been pretty much studying bass for a good 25 years maybe, almost 30. It's been a long time.
'Cause I can't imagine living without you.
Well, my style of playing bass is probably a little, I don't know what you call it, handicapped maybe, a little off the wall. But Really, I believe the way I'm playing the bass is the way everybody should play. I play it upside down, which the bass string, my lowest string E is on the bottom and my high string G is on the top. But when I was a kid, every day after school, getting home and trying to pick up guitars that were laying around the house, I didn't know that I was playing it upside down. So eventually, the more I got into it, it just started being comfortable because I am left-handed. My mom and dad is left-handed. And it's just been a series of teaching myself how to play the instrument the wrong way. And over time, it's just, I've adapted a style that, I don't know if you can compare it to many others, but it's definitely something I own up to and I won't change for nothing in the world. But I tell all the right-hand players, you need to switch over to left hand so you can do some of the stuff I do. Well, my influences really were guitar players. I've always wanted to play bass, but I wanted it to sound like the different sounds of a guitar, which is not normal. But that kind of brings me to today. I'm playing a normal bass, and this here is a normal bass, but I've taken it and put strings on it to make it sound an octave higher than this normal bass here. So when you hear it, I actually make sounds like a guitar. Which allows me to solo and play melodic lines and kind of play what I feel from the heart. I take the phrase, you are what you eat. I know many of you have heard that phrase before. But when I listen to music, and a lot of times the musician, they are what they listen to. I try to open myself up to all music that doesn't necessarily cross the border with a lot of things I don't agree with, because music is definitely a spiritual side to it too. So I stay away from a lot of the, the head banging and different things like that. But some of my best practice of listening to music is on the radio. I listen to all styles, and the radio is one of the best things that gives you a variety of music all and up and down the scale to just switch from one thing to the next. So, if you wanted to take something from radio, make sure you learn your styles. Learn everything you can about the music styles, whether it's country, blues, jazz, R&B, folk, classical. All of that is on the radio. And that's probably the best place and the most economical place where you can catch music without paying nothing for it.
There is love at the foot of the cross.
I played with quite a few artists. One that I grew up with in my living room trying to learn how to play drums, bass, and everything was the amazing Jolie Gone and the Mighty Clouds of Joy. So I grew up trying to, I actually thought I was playing behind the Mighty Clouds of Joy. When they would play, that was me on the drums, I would switch to the bass. And of course, most kids do this. They set up the living room with chairs and everything, and you get the sticks from the coat hangers, and you just pretty much do your concert. So having the opportunity to actually play with them and write 2 songs for them, it just, it kind of floored me for a full circle of what I started doing when I was a kid. Never knew I was going to be able to work with these guys. And there have been many others since then that I've had a chance to work with. Gospel, CCM artists, just jazz artists, just quite a few people. Kurt Whalen, he's been one of my favorites that my brother kind of introduced me to when I was younger. And Kurt Whalen has a sound that just, I can identify in any kind of music. So I've had a chance to work with him, play with him. It's just an amazing experience. So through that, just through my life of music, my first bass was a Fender. And I was probably 11 years old when I got this first bass. And after getting it, my dad, once again, tried to take me to get a lesson. And with this Fender bass, the guy told me, I'm not going to be able to teach you unless you turn it right side up. Play it the right way, what he was saying. You got it wrong. I can't teach you playing it like this. So after he tried to teach me Mary Had a Little Lamb, I was already playing quartet music and you know, all the stuff behind Mighty Clouds of Joy. So after that, I told my dad, I said, I do not want to go back to that lesson again, because I was already in church playing music and stuff. So Fender has been a part of my life for my, oh my God, my entire career. I love it, and the way that I'm playing it, I can't hide. It's upside down. You notice it. There are a few things that I deal with that a right-handed player wouldn't. The way that the wings are cut, sometimes I can't always get up to the notes like a right-handed player would. So I have to modify it and do it over the top with different things. But I just enjoy my controls being up here where I can get to them easier. If somebody gave me a right-handed bass that was actually made for a left-handed, I couldn't even play it because I'm so used to this, I guess, handicapped way of doing it. But it's just been great. I wouldn't change it for the world. Okay. If I had to leave anything behind, it would be think out of the box. Be creative. Just because it hadn't been done doesn't mean that it's not going to be done. Before I knew of an upside down bass player or guitar player, I had never seen one. But that didn't stop my journey of trying to achieve and be the best at my craft and my gift that I could be. So always think out of the box. Always know whether there is a gig that's calling you, a studio session, or someone that's needing you to play for money. It's not all about the money. There are times where I've put together a tour called Inspiring Hearts, where we go to hospitals, rest homes, and shelters and give free music to people that can't quite get to a concert or any kind of, show or venue. So with your gift, make sure that you do your best at giving it away in the right purpose and the passion and the cause of doing it. It will always come back to you. Again, my name is Bernard Harris, bassist right here in Nashville, Tennessee. Be inspired.
Jesus reigns forever. Jesus reigns forever. Jesus reigns. Jesus reigns forever. Jesus reigns forever. Jesus reigns forever. Jesus reigns. Jesus reigns forever. Jesus reigns. Jesus